My name is Liz. I'm a member of the clinical education team. Today we're going to talk about how to prescribe medications in the outpatient setting. We're in the chart phase for Snow White. You can see right here under this window that Snow currently does not have any medications ordered through ICANotes. You can order medications from any complete evaluation or any prescriber progress note. Let's come in here as prescribing clinicians and click the progress note. We have two tabs in the progress note. I'm not going to treat this as a regular clinical note. I'm just going to skip over here to part 2 and zero in on just the medication order workflow, which is right here. To order medications, you're just going to pop open this work field. And now we can see the areas where all the medications can be entered in. Right now, of course, we don't have any medications in here. The workflow to enter medications is always a left to right workflow. Okay, and the first field that we use is going to have a drop-down menu of verbs. So let's say, for example, I want to start Prozac. I'm going to click Start. I'm going to key in PROZ, and the program is going to take me right down to the Prozac. By the way, if the medication that you're looking for in this drop-down menu is not here, you can enter this Enter Drug List area, add in any medication and associated dose that you want to add it into your drop-down menu. All right, let's go on here with the Prozac, 20 milligrams, and I'm going to say PO, QAM, and you can ignore the VO, RB, this is for nurses, verbal order read back. The number to dispense, you're going to dispense 30. You can decide on how many refills you want, over how many days you want it to be given, and you can put a comment in as to why the patient's getting it. I'm going to type in DEP, and it's going to pull depression for me. We don't worry about the omit or in the note. Don't worry about the RX status. We do have an optional area that might be useful in the outpatient setting. It's a consent field. You're not obligated to use it, but if you'd like to use it, it's here. When it's yellow, it's at rest. It means you haven't done any documentation regarding the patient giving you the okay or approval to take Prozac. So let's come in here and say the patient approves. We're just going to click on the yellow box, and it's going to open up the consent detail field for Snow White for the Prozac, and it says here consent was given by the patient or the parents or mom or dad, or you can even edit this list if you'd like to. I'm going to say patient. Note that if the patient refuses to take the Prozac, maybe she says, oh, God, I've gained too much weight on that in the past, this is what you would do, and you type in a comment. When I click done, I get a red check mark here saying, and it would hover and it would tell me that Snow is refusing the Prozac because it makes her fat. But in this case, she really doesn't have a problem with it, so I'm going to erase, uncheck this box, and say yes, she says I agree to give Prozac a try. When that happens, the consent area turns green, indicating that consent for this medication was given, and it has your name and a timestamp associated with it. The start date is only used if you write a prescription today, but you don't want it to be started until next Monday or next Wednesday or what have you. Don't worry about these fields. They're relevant to the inpatient setting only. Here's our little print area. It's turned green, but I'd like to add 3 more meds to show you how I can print 4 prescriptions on one sheet of paper. So let's come over here and add some more medications. I now have 3 scripts ready to print. Let's go for the last one and let's just order a medical, like something like Lasix, which we also have non-psychotropic meds on this drop-down list. GI, GU, pain medications, sleeping medications, what have you. If you're looking for a medication that's not on this list, you can easily add it by clicking this button, typing in the name of the medication and the related dose. It will automatically appear in this area for your use. Notice that if I made a mistake, treat these fields just like a Word document. If your cap lock's on or you misspell something, you can back it up and erase it and retype. It's no problem at all. Okay, so we've got all 4 of our medications here. And to print all 4 of them at one time, I'm going to click over here in the checkbox, Print Selected. 1, 2, 3, and 4. To set this up for yourself to print either 2 medications per page or 4 medications per page, you need to call our support team, and that number is 443-569-8778. They can also they can set this up for you so it prints to your default mechanism. The default in ICANotes is to print just 1 script per page, but let's take a look at what this would look like when I do a print preview. 4 of my medications. Here's the first one, and the second, and the third, and the fourth. Of course, you would be printing them out on printer-specific paper. Our support team can also give you a website resource where you can order that specific for your state. I'm going to go ahead and click Done for right now. Here's my 4 medications. Now, if you've changed your mind about the dose, maybe you want to take the Abilify down to 1 milligram, you can certainly do that right now. Just re-enter this area, come over here to the Abilify. I don't have a 1 milligram dose in here. You know what, I'm going to show you how to edit that in the drug list. That'll be really quick and easy. I'm just going to add a medication. It's that simple. I'm going to click Save. It's been added to this list, and I'm going to go back and re-expand my medication order field. Click on my Abilify, and here's the 1 milligram ready to go. Okay, so now I'm happy with all of these medications. I'm going to come down here and click Done. Okay. Your medications show up here. They're going to show in bolded and black on this note because all medications have been updated on today's note. We're going to go ahead and compile this note with just my med orders. You could also compile your med orders associated with a clinical note. It doesn't matter. Here's my compiled note. It has my diagnosis and it has my 4 medications that I've ordered in bolded and black: Prozac, Ambien, Abilify, and the Lasix. I can change the title of this since it's, in my mind, it's not really a progress note. It's more a note where I've captured medication orders. You can do that by coming over here to change note title. Notice it's in green so you can get in here. The trick to this is to click None on the top and to click Other, since I don't have medication orders written over here as a custom button. And I'm just going to say, but you can type in here anything you'd like. Click OK. And then instead of saying psychiatrist, I might want to put my own name down here as a physician or maybe as a nurse practitioner. And now I'm going to have a nice heading on this note. Medication order updates by Liz RN or Liz MD. And I'm logged in as an MD, which is why it's showing MD here. Of course, you will want to electronically sign this. We're going to go back to the chart face. There's a little bit more I'd like to show you. First of all, under current medications, you can see they're all listed. This field and all of these fields along here are going to show you the most current information. If your patient or a family member would like a copy of their medications, a printed copy, you can click this button right here. I'm also going to take you into the log area up here. We log a lot of information on ICANotes, including start and stop times and changes made for meds. Let's come over here. The medication log actually opens by default. It's the first of many logs, so you don't have to search too hard for that. And you can see that Abilify, Ambien, Lasix, and Prozac were all started. If you click on this button here, it'll take you to a website where you can pick up information, educational information about each of the medications, print it out, and give it to your patient. Let's talk about this field for just a minute. I'm going to come back to the chart face, and we're going to pretend like it's a month later. And I'm going to open up a new progress note, and I'm going to go to progress note part 2. And I'm going to expand my medication field because I want to make some changes. So the first thing I want to do is I want to increase the Prozac. This is a really simple workflow. Do not stop the Prozac 20 and increase it down here. Rather, just come down here and click increase Prozac to 30. It's a very light touch. If you follow this workflow, it's going to make your log area much cleaner. And that's all I have to do, increase the Prozac. Let's say that the patient had a bad reaction to the Abilify. Let's do the weight gain again. So you're going to stop that. I'm going to come over here and just click stop. That's all I have to do. Okay, I've changed 2 of my 4 medications. And of course I could come across and update this and print them out. But just for the interest of showing you how this will look in the chart face and on the medication log, I'm going to come over here and click done. And I'm going to save this to a progress note format. Once again, I could update the title of this note if I wanted to, but let's just come down here and you can see that all 4 medications are showing Prozac, Ambien, Abilify, and the Lasix, but only the 2 that you changed in this note are in bold and in black. So you've increased the Prozac and you've stopped the Abilify. You've got your name here. We're going to sign this. Let's go back to the chart face. You can see that this area has been updated. The Abilify is gone. The Prozac now shows Prozac 30. I'm going to take you back into the log area. Once again, when I open it up by default, it opens up to the medication log. You can see here, I stopped the Abilify. Now I can come over here and put down a comment. This is nice because over time, maybe 2, 3, 4 years from now, you say, well, let's try some Abilify. And the patient will say, no, I gained too much weight on that. When you look at the medication log, you'll see that you had documented that as such right here. Let's go back to the chart face. There's one other area that I want to show you. It's outside of the chart face for Snow White. We're going to go back to the chart room, which is you can always access from the top left corner. And I just want to show you the settings in settings and directories that I set up to be able to, I came in here, I'm logged in under my name, Liz Lobeo, MD, my doctor's name, and I'm going to come over here to options. And this is how you can put your signatures and what have you, how you want them to show in the program. But under this area right here, do I want to use a custom letterhead? And I clicked yes. And I had typed in the name and Hamilton Hospital and the date of address. So you can customize the letterhead on your printed prescription right here. This is where that happens.